I'm hitting the woods with my ouch bleeper because we've brought Ouch and About inside the hospital.
Wow.
Dr. Xand!
Oh, and I'm hitting the streets to answer your medical mysteries. In the hospital, Chris has his first call. It's from Dan, who has a rash all over his body. So what's your question?
My question is, what makes the blood vessels burst in Henoch-Schönlein purpura?
Come again? What's the diagnosis, Doc?
That sounds to me like a case of, I want to know what makes the blood vessels burst in Henoch-Schönlein purpura-itis.
That's a right mouthful.
Do you have Henoch-Schönlein purpura?
Yes.
And is that why you've got that rash?
Yes.
First of all, let's have a little look.
Sure.
Do you want to drive the ouch cam? So looking here, we can see that the blood vessels have leaked a bit of blood under the skin.
That's a good one, though.
That's a really good one, isn't it?
But why does Henoch-Schönlein purpura make this happen?
Well, this is caused by Dan's own immune system attacking his blood vessels. The lining of the blood vessels becomes inflamed and those blood vessels become leaky.
Yeah.
Now, Henoch-Schönlein purpura, as weird as it sounds, is actually very, very common. And most of the time, it gets better with either no treatment or a short course of drugs called steroids.
OK, Dan, well, you have been an absolute star. Would you like an Operation Out sticker?
Yes, please.
Thanks, Daniel. I'm Ouch and About on the street, and I think someone has a question for me.
Why do you cry?
Why do you cry? That is a really, really good question. The main thing about crying is that you're making signals to other people that say you're upset. Your tear ducts are making tears. The tears also run inside your nose, down a thing called your nasolacrimal duct, which means your nose tear duct. And so you get a runny nose, and then you're sobbing as well. And we have bits of our brain that are very good at seeing when people are upset, and then we go and help. So when you're crying, do people help you?
Yeah.
Yeah, it's good to have a cry. I have a bit of a cry now and then as well. Usually when Dr. Chris is being mean to me, or if I can't find Mr. Grumbles.
Thanks very much, Benjamin.
Goodbye.
Oi, Chris! No sleeping on the job. You've got another question. It's from 9-year-old Dolly.
How do you do?
5.
What's your question?
How does my infusion pump work?
What's the diagnosis, Doc?
Sounds like a case of, how does my infusion pump work, itis?
That's right.
Why are you in hospital?
Because I've got short bowel syndrome.
What does that make it difficult for you to do?
Absorb food properly
So, how does Dolly absorb food?
into my heart.
Into your heart?
Dolly has a tube that goes straight into her heart. This allows a special nutrient-packed food to be put directly into her bloodstream with the help of an infusion pump. So how does it work?
This is how much food Dolly needs for 12 hours. But obviously, she can't have it all at once. So we trickle it from a tube here down into the infusion pump. And then if you look here, when that moves, it's like a pair of fingers squeezing food along the tube, a bit like squeezing toothpaste. So the infusion pump allows a really controlled amount to go into Dolly's heart. So you can eat stuff with your mouth, can't you, as well? But you just can't eat very much. What's your favourite food?
Roast dinner.
Roast dinner? OK, well, you're not alone there, Dolly. I always have tomato ketchup with my potatoes.
I'm with you, Dolly.
I think you've earned yourself an Operation Out sticker. Good job. Bye.
Bye.
Job done for today. Clinic closed. We're both Ouch and About. I'm hitting the wards with my ouch bleeper.
Have you got a question for me?
And I'm hitting the streets to answer your medical mysteries. At the hospital, Xand's busily playing tennis.
I'm about to beat Dr. Chris's record. 97, 98, 99. Oh no, a bleep! Ah!
You'll never beat my record. Get to your first call. It's from Mohammed, who was rushed to hospital after he fell onto some railings.
Hi, Mohammed, how are you?
Good.
Now, have you got a question for me?
How does my windpipe work?
What's the diagnosis, Doc?
Sounds to me like a case of, I'm Mohammed and I want to know how my windpipe works, itis.
That's a mouthful.
The medical name for your windpipe is your trachea, and it runs from the back of your throat down and splits in half and goes into each of your 2 lungs. Now, the windpipe has one very important job. It has to not collapse. So your windpipe is made up of a tough stuff called collagen. with cartilage rings, and the cartilage rings keep it open and stop it collapsing. So even if you squeeze your throat a little bit, you can't collapse your windpipes. You've always got air going into your body. But you did more than push on it, didn't you, Mohammed? I mean, you actually jabbed a hole in it with a fence.
It hit my throat, under my throat, then I had a small hole.
Now, what kind of ambulance did you get?
And then again, ambulance, I got a helicopter.
You got a helicopter?
Yeah.
Do you know what they did in hospital then?
Stitched me.
And so now the hole's mended, you've got a bit of a plaster on there.
Yeah.
And how are you feeling?
A little bit good.
Well, you have done a brilliant job and you have earned an Operation Ouch sticker. Thank you very much indeed.
Thank you.
Thank you, bye.
Thank you. Bye.
Meanwhile, I'm ouch and about on the street.
Dr. Chris, I've got a question for you. Why does brain work and why do you have thoughts?
How does the brain work and why do we have thoughts? That might be the hardest question it's possible to ask anyone. What your brain does is it's a way of taking in information from all your senses, so from your eyes and your ears and your skin and your mouth, and then your brain decides what to do with that information and controls your body. But why do we have thoughts? No one knows the answer to. So to answer that question, you are going to have to become a cognitive neuroscientist. Do you think you could do that?
Yes, I'll try.
You'll try. Good for you. Here you go.
Back with Xand, another call's come in. It's from Kate Lou and Ella, who are visiting their sister in hospital.
Hi, Kate Lou. Hi, Ella. How are you doing?
Good.
Have you got questions for me?
How come I've got a bigger mouth than my sister?
What's your question?
How come I've got eczema and my sister hasn't?
What's the diagnosis, Doc?
Sounds to me like a case of I want to know why I've got a bigger mouth than my sister, and my sister wants to know why she's got eczema and I don't. Itis!
Now that's a record.
Let's start with your big mouth. Show me how big your mouth is. Wow, that is a big mouth. So everyone has different sized mouths, and most of that is about your genes. Everyone gets a slightly different combination of your genes, but even Dr. Chris and I, who have the same genes, we should be the same in everything. Actually, one of us would have a slightly bigger mouth. I just don't know which. Okay, eczema. Why have you got eczema and your sister doesn't? Well, some bits of eczema are genetic, but you don't have all the same genes as your sister. You've got a few different ones. But also, everyone grows up in a slightly different way. So all the other things in the environment that cause eczema, like which germs you're exposed to and what things live on your body, they'll all be a little bit different from your sister as well. Have I answered your questions?
Yeah.
You have both earned Operation Ouch stickers.
Thank you very much.
Bye.
Bye.
Job done for today. Clinic closed. I'm hitting the woods with my ouch bleeper because we've brought ouch and about inside the hospital.
Wow.
Dr. Xand, Dr. Xand.
And I'm hitting the streets to answer your medical mysteries. In the hospital, Chris is performing a very tricky operation.
Almost there. A question.
And he's off to see Alex, who's just had an operation on his esophagus.
Hi, Alex. I got your bleep. What's your question?
Why can't you eat or drink before surgery?
What's the diagnosis, Doc?
Sounds like a case of why can't you eat or drink before surgery-itis.
This question's making me hungry.
Well, I think I can answer the question. Before you have any operation, the reason you can't eat is because when you're lying down and when you've had an anaesthetic, you can't cough. And so if food comes back up from your stomach, goes into your windpipe, your trachea, it can then get into your lungs, and that'll be really bad because you can't then breathe and you'll get a pneumonia. Once you had your operation, how long was it before you could eat?
4 hours.
Okay, so what did you eat?
I had 2 rounds of toast and then another 2 rounds, 4 chicken goujons, a couple of chips and a bit of salad. And then after that I had a yoghurt.
Wow, you must have been super hungry.
You have earned yourself a sticker. I think we should probably try and put it on your esophagus, shouldn't we?
Yeah.
Cheers, Alex.
Thank you.
See you soon.
Bye.
I'm ouch and about on the street, and I think someone has a question for me.
Dr. Xand, Dr. Xand, I've got a question.
Oh, Heidi, what's your question?
Well, you know when you do this and you point to a finger without touching it,
Okay, try and move this finger. You moved the wrong one.
why can't I lift the right one?
What's happening is your brain is getting 2 different bits of information. If you do that and you look, the visual information that your brain's getting is very confusing. You've just got a whole mess of fingers and you can't tell which one is which. You don't know which finger to send the message to. But if I touch it, that's easy then, right?
So if you touch the finger, there's a wire, effectively a nerve, carrying the message exactly to the right bit of your brain, and then your brain knows what to do. Does that make sense?
Yeah.
That's a very complicated question, but very important one. Thank you.
Back in the hospital, Chris has been bleeped by Amelia.
Hi, Amelia. What's your question?
What is a tracheostomy?
What's the diagnosis, Doc?
Sounds like a classic case of, I want to know what a tracheostomy is, itis.
Well, that's easy for you to say.
Now, why are you interested in what a tracheostomy is?
Because I narrowly avoided getting one. I was in intensive care for about 5 weeks with a really bad lung infection. But on the day when I was supposed to get the tracheostomy, I just started breathing again.
When you were on the intensive care unit, were you on a thing called a ventilator?
Yeah, big tube down my throat.
And it blows air in and out of your lungs. But if you have a tube going through your mouth and into your trachea, your windpipe, for too long, it does a lot of damage. So doctors can perform something called a tracheostomy. Now, any ostomy is a hole between an organ and the skin. So a tracheostomy is where there's a hole between the trachea, the windpipe, and the skin. And so if you make a little hole in that, you can put in a tube that someone can then breathe in and out of, or that can be connected to a ventilator. Have I answered your question?
Yes.
I'm going to leave you.
Yeah, I get a sticker. You
Is
can
that
put
all
it
right?
on the teddy bear.
Teddy can get it. Thanks, Amelia.
Thank you, Dr. Chris.
Cheers, Amelia. Hope you get better soon.
Bye.
Job done for today. Clinic closed.
We're both ouch and about. I'm hitting the wards with my ouch bleeper.
Have you got a question for me? Wow.
And I'm hitting the streets to answer your medical mysteries.
Xand's in the hospital canteen, but there's no time for snacking. It's bleeper o'clock. It's from Ruth, who's had an ankle operation.
Hello, Ruth.
Hello.
Have you got a question for me?
Yeah. Why do I got a squishy nose?
What's the diagnosis, Doc?
Sounds like a case of, why do I got a squishy nose-itis?
Let's see if you knows the answer.
Now, Ruth, how squishy is your nose? That might be the squishiest nose I've ever seen. Everyone's nose is a bit squishy, isn't it? Because your nose is mostly made of cartilage, and cartilage is rubbery, but most people's cartilage is quite tough, whereas yours is really, really flexible, isn't it?
Yeah.
You've got a squishy nose for the same reason you've got a problem with your ankle, haven't you? What's the main thing you've got?
Larsen syndrome.
Larsen syndrome means that some of her tissues, her connective tissues and her bones don't quite grow the same as other people's. Have you got some other problems with bones as well?
Yeah.
Wow.
So what Ruth's doing there is dislocating her knee. Her knee's actually popping out of joint. Because you've got very stretchy ligaments around your knee and the muscles are a bit looser, you can just pop your knee out of joint and then pop it back in again. And does that hurt at all?
No.
Well, thank you very much. I think you deserve an Operation Ouch sticker. Bye.
Bye.
Meanwhile, I'm out on the street.
Does anyone have any medical mysteries for me? Oh, hello. What's your question?
Why do I lose 2 teeth?
So first of all, show me the teeth you lost. Oh, wow, those 2 bottom ones.
Yeah.
Do you know what those 2 teeth are called? They're called incisors. You lost your bottom 2 incisors. And the reason you lost them is because when you're born, you have your grown-up teeth up here in your maxilla, which is a bone of the skull, and you have your grown-up teeth down here in your mandible, which is your jawbone. And as the grown-up teeth start to come through, they push out the baby teeth. So there's nothing to worry about. Losing baby teeth is completely normal. And because you asked such a great question, I'm going to give you an Operation Out sticker. There you go.
Thank you.
Another happy customer. Back in the hospital, I've had another call. It's from Sean, who has cancer.
Hello, Sean. How are you?
I'm good, thanks, Dr. Xand.
Now, have you got a question for me?
Yeah. How does cancer form?
What's the diagnosis, Doc?
Sounds to me like a case of I want to know how cancer forms itis.
Now that's a tricky question.
Cancer is when your body's cells keep dividing. They divide too much. And so somewhere in your body, one cell had a genetic mutation. A bit of its DNA went wrong. And the gene that stopped it dividing too many times got switched off or got damaged somehow. And so it started making more and more and more of them. So what kind of cancer have you got, Sean?
Acute lymphoblastic leukemia.
Acute lymphoblastic leukemia.
Yeah.
So leukemia is a kind of cancer of your blood cells, and Sean's particular kind of cancer is a white blood cell cancer. And so you effectively have too many white blood cells. Now, white blood cells are really useful. They fight infection. The problem is, and if you're making too many white blood cells, it crowds out the other kinds of cells you need. What kind of treatment are you having, Sean?
Chemotherapy.
So the reason you're having the chemotherapy is to kind of reset those genes. Sean, have I answered your question?
Yeah, thanks.
Here's an Operation Ouch sticker.
Thanks, doctor.
Bye.
Bye.
Job done for today. Clinic closed.
Now I'm hitting the wards with my Ouch bleeper because we've brought Ouch and About inside the hospital.
Wow.
Dr. Xand!
Oh, and I'm hitting the streets to answer your medical mysteries. In the hospital, Chris is in a right pickle.
Ugh, a question.
Someone's hungry for answers. It's from Ben, who's had a leg operation.
Hi, Ben. How are you?
Fine.
What's your question?
Why did he put orange stuff on your leg before an operation?
What's the diagnosis, Doc?
Sounds like a case of why do they put orange stuff on your leg before an operation? Itis. It's a sterilizing paint, so it kills all the bacteria on your skin, and that means when they do the operation, no bacteria get in your body to cause infections. But the reason it's orange is because that tells the surgical team where has been cleaned and where hasn't. So if you're doing an operation and suddenly you notice there's a bit of skin that isn't orange, you know that bit of skin is dirty and it needs to be sterilized. Does that answer your question?
Yes.
There you go, Ben. Have a sticker.
Thank you.
I'll see you soon.
Bye.
I'm Ouch and About on the street, and there's someone waiting to see me. It's Rodas, who has an allergy to nuts.
How does EpiPen help you when you have a nut allergy?
Well, nut allergies are very common. They're one of the most common allergies there are, and they can be very severe. Basically, your immune system recognizes the nut as something bad, and you get swelling all over your body. The swelling is very dangerous if it's happening in your mouth or in your throat, because it stops you breathing. Now, the EpiPen is full of a hormone called adrenaline. When you inject it, it will tighten up your blood vessels and decrease the swelling and allow you to breathe again. So if you're carrying an EpiPen, you are safe, which is really important. Keep your EpiPen with you, all right?
Back on the ward, the bleeper's bleeping.
It's a question from Jamie Lee, who's just had a chest x-ray.
So what's your question?
Why are burns white on an X-ray?
What's the diagnosis, Doc?
Sounds like a case of, I want to know why bones are white on an X-ray, itis.
Make it snappy, Chris.
I'm going to try and answer that. But first I need to explain how X-rays worked in the past. We'd put a piece of film behind Jamie's chest, and the piece of film is white. And then we'd shine X-rays, which is like very powerful light, through your chest. The X-rays would pass through soft tissue, like your lungs, and hit the film, turning it black. But your bones, because your bones are made of hard stuff, a bit like rock, the bones absorb the X-rays, which stops them from reaching the film, so it stays white. The truth is now, we take X-rays using digital film, so we can actually colour them how we wanted, but doctors got used to seeing them the old way in black and white, so that's the way we've left it. Does that answer your question?
Yes.
Good. I think you have earned yourself an Operation Ouch sticker. Do you want to stick it on your chest? Thank you, Jamie. That was an excellent question.
Thank you, Dr. Chris.
That's a pleasure. Bye.
Bye.
Job done for today. Clinic closed.
We're both Ouch and About. I'm hitting the wards with my Ouch bleeper.
Have you got a question for me?
Yeah.
Wow. And I'm hitting the streets to answer your medical mysteries.
In the hospital playground, Xand's in a right tangle. Quick, that's your bleeper. It's from Ellie. She's recovering from an operation.
Hi, Ellie. How are you?
Hi, Dr. Xand.
Do you have a question for me?
How does your spine keep you up on your feet?
What's the diagnosis, Doc?
Sounds to me like a case of, I want to know how your spine keeps you up on your feet itis.
You'd better put your back into this one, Xand.
So your spine is made of bones called vertebrae. They stack up, and between each one is a rubbery disc of cartilage. And that means your spine is almost like a sort of flexible, bendy pole that's quite strong, but that on its own won't hold you upright. What you need around your spine is all the muscles that keep it held straight.
So if you just had muscles with no spine, you'd still flop?
If you took out your spine, you'd just collapse in a heap of jelly. But if you took away your muscles, you just fall down like a stack of blocks. So you need both muscles and bones. Why are you interested in your spine?
Because I had an operation on my spine, because I have cerebral palsy.
How do you explain cerebral palsy?
The signals in my brain get muddled up to go to my legs so that I walk on my tippy toes.
And did the operation fix it?
Yes.
You deserve an Operation Ouch sticker.
Thank you.
Can you show me your walking?
Brilliant, Ellie. Dr. Chris is stepping out too. He's on a quest for questions.
Dr. Chris.
What is your medical mystery question?
My question is, on roller coasters, it feels like I don't have a stomach.
So what you're describing is when the roller coaster gets to the top and you go over, that's when your stomach rises. What you're experiencing there is no gravity. So you're floating, and it's a bit like being in space. It can make you feel quite sick. What do you have to remember when you're sick on a roller coaster? You've got to be sick into the air so that it goes over all the people behind you.
Yuck! Chris?
Can I give you a sticker?
Come on, Xand. Don't tell me you've never done it. That's your next call. It's from Bethany, who has an infection.
Hi, Bethany. How are you?
Hi, Xand.
So have you got a question for me?
I do. How do painkillers know where the pain is?
What's the diagnosis, Doc?
Sounds to me like a case of, I want to know how the painkillers know where the pain is itis.
Ouch. That sounds painful.
The thing about painkillers is they actually don't know where to go. What they do is they work all over your body. Now, are you taking painkillers at the moment?
Paracetamol and ibuprofen.
These painkillers act both in the brain, where they stop pain signals being received, and elsewhere in the body.
So wherever you have inflammation, you tend to get hot and red and swollen, and the anti-inflammatory painkillers that you're taking are damping down that inflammation so it hurts a bit less while your body mends. Does that make sense?
It does.
Here you go.
Thank you.
Bethany, thank you very much. Bye.
Bye.
Job done for today. Clinic closed.